the next session, it's a pleasure to introduce two presidencies, Hungary and Poland. Those of you who have been to DHS summits before will know that we have a long association with EU presidencies. And I'm going to start with Hubert Zielinski, who is going to talk to us about Poland, and in particular, he is the Deputy Director of the Department of E-Health in Poland. So without further ado, Hubert.
Uh, Thank you. Thank you for an invitation. It's a pleasure to be able to talk on behalf of the Ministry of Health to tell you something I hope interesting about the digital health developments in Poland. I've been informed that I should be capable of operating my presentation. Which is about to happen, I believe. For the time being, we're seeing the Hungarian one. All right, I am now able to steer this presentation. So here we go. The digital health in Poland has its key strategic dimensions embedded in both national and international or European documents, of which Strategy for Responsible Development until 2030, National Recovery and Resilience Plan, or Healthy Future strategic framework for the development of health system with an outlook to 2030 are worth mentioning from the domestic dimension. As regards the EU dimension, I would bring up the Digital Decade Policy Program until 2030, or the HDS regulation that is coming up in the first quarter of 2025. As regards this e-health development program of Poland, we have a significant document put together, which identifies main directions as regards the digital health development in the time frame until 2027. This is an operational grade document, in contrast to the strategic ones that have been presented before. I would say that the digital transformation of key areas of intervention, patients' engagement in activities which increase control of patients over their own health, the institutionalization of care, strengthening the digital maturity of service providers supported by e-services, education of medical and technical professionals, development of telemedicine and m-health, AI application, development of back office services are the key areas that we would like to focus on. Some numbers as regards Polish maturity of digital health sector. If we are to quote the EU available statistics from 2023, and I'm referring to Digital Decade numbers, we're talking about the maturity score of 90%, which is an increase of 4 from 86 in 2022. We can say that we have a centralized, established nationwide access service to electronic health records. We say that all of our population is technically able to access the services for e-health records through native mobile application and patients portal. We say that we score. We are a bit of underperformers as regards the categories of health data being available. This is 60% compared to European average of 74%. So we have some catching up here to do, but when it comes to the access to electronic health record and to digital maturity, we are respectively above the average as regards the maturity. It's 90%, and the average is 79%. As regards the access to EHR, the European average is 76%, and we have scored 100%. The e-health development program has its 3 stages, and we have envisaged the first stage, which is the implementation of e-services and starting of various projects which are going on currently. First of those projects is a central e-registration service. We are pursuing the development of mHealth solutions in a form of health applications portfolio. We are striving to widen the scope of telemedicine procedures available in a public health, a public sector context. We are obviously working on improving cybersecurity knowledge. By that, I refer to establishing a computer security incident response team at our digital health agency. And last but not least, we're monitoring health innovations. Second stage of this operational program, solutions supporting coordinated patient care, are being developed. This is, for example, a home medical care platform, which I will talk about a little more later on. This is e-pregnancy card. This is child health e-card. This is the Cabinet Plus application, e-referral for laboratory tests, central registration, which is currently in its test phase, pilot phase, which will be then extended to a systemic scale. This is the further development of central systems and strengthening their security. Third stage, this is the widespread solutions. This is envisaged to last until 2027. And we have put here the further development of patients internet account, and patients internet account mobile application, telemedicine tools used to predict patients' health, use of AI models and tools strengthened by analytical tools designed to achieve an optimization and improved reporting of data. Here on the slide, you have a graph or a drawing, basically, or a scheme which depicts current building blocks of the Polish e-health system. As I said, we have patients' internet account. I will run you through some numbers on the next slide, but nevertheless, you have a patient's internet account, you have e-referral, e-prescription with the cross-border component of cross-border e-prescription. We have electronic health records exchange. We have central e-registration, which is being currently piloted and then scheduled to go whole scale. We have development of telemedicine, and at the bottom you have a patient's portal, pacjent.gov.pl, and a solution offering all access to all available digital health services for health professionals. As you can see, those e-health services are fairly new. E-prescriptions have been with us since January 2020. E-referral has been launched in January 2021. It was followed by reporting of medical events in July 2021, which has become mandatory the following year in July 2022. As promised, here are some numbers for you to digest. First of all, we have at the bottom center tile, we have 2.3 billion e-prescriptions which have been issued hitherto for roughly 38 million patients. E-prescription is a systemic service which covers almost 100%. It is 98% of e-prescriptions being issued in Poland. We have 229 million issued e-referrals so far. We have 242 million indexed documents. You could relate this number to the exchange of electronic health record. In order for it to take effect, you need to properly index relevant electronic health documents. What is also interesting from my perspective is our personal patients internet account has accounted for almost 19 million individual users, which in context of 38 million population of Poland is quite substantial. We are happy that this number is the number of active users is growing. I believe that this is no this isn't unexpected, that it was the pandemic that triggered this surge in number of people willing to use the remote ways to provide healthcare. And patient's internet account is a place where you have access to all relevant health information from an individual's perspective, plus access to all documents which have been issued. I refer to e-referral, prescription, or information on vaccination, for example, plus the information on individuals' interaction with the healthcare system. 2.4 million users of mobile version of patient's internet account, because there are two. Basically, one is a browser-based solution, and the other one is application-based solution. And we have over 1 billion of registered medical events. I would like to say that we have an eye on innovation at the ministry. We have constituted an innovation board which is responsible for monitoring of new trends, new offerings, new ideas, be it medical devices, be it software, be it automatization procedures, be it back office solutions. We are trying to keep track of what's going on currently in Europe. We are also running an innovation map, which sort of depicts what interesting ideas and products derive from Poland, and they are placed on the map of our country, obviously. And we are working to have the entrepreneurs cooperating with the public sector by means of Warsaw Health Innovation Hub, which is run by Medical Research Agency. And we are trying to combine the possibilities offered by the public sector with the expertise available among entrepreneurs and companies from the sector. I refer to the health applications portfolio. We are piloting the health applications portfolio, which could be associated with the whole infrastructure to test, prove, and certify health-related applications. We have started in 2023, and we are making those applications available for free to our patients. Apart from this pilot phase, we are also currently applying for funding for a project to expand health applications portfolio to reach several apps within 2 years. From 20 to 24, we have worked together with the Norwegian Center for eHealth in a field of telemedicine. We have developed 6 telemedicine models in the areas of cardiology, geriatrics, psychiatry, obstetrics, diabetology, and chronic diseases. We have also developed a report on palliative care. We are working towards making selected procedures available for the patient within the public healthcare context. The home medical care platform, which I briefly mentioned, is a tool which where we strive to test a combination of medical device which gathers data plus tools to process and analyze the information or the data that has been gathered. Initially, this platform served as a place of collecting the data from pulse oximeters during the COVID-19 times. It has evolved into a platform of testing devices like e-stethoscopes, wristbands, spirometry, and last but not least, a smart doctor multifunctional device for diagnostics. We are trying to turn our attention also to health professionals and make it possible for them, no matter where they work, to get the ability to consult relevant professionals and specialists, initially in the field of cardiology, and this is with the means of e-Consilium project. And in the case of e-Consilium second project, we are widening the scope of possible consultations, and we are extending it on lung diseases, hematology, oncology, cardiology, and rare diseases in children. This second iteration of the project is scheduled to start in the fourth quarter of 2024, and this is professional consultation with the use of remote communication. The telemedicine roundtable is something which we run since November 22, and this format of meetings has to do with keeping contact and making both sides sort of relevant. First side is the public health authorities, and the other side is entrepreneurs and companies from the area of telemedicine. And we're trying to push the telemedical agenda also with the help of such format of meetings, which are fairly successful. Last time we had roughly 200 participants. And obviously, last but not least, let me walk you through this assumption that we've made in the area of digital health as regards our presidency, which starts on the 1st of January. One caveat which I would like to mention beforehand is that the finalized priorities and the areas which we will tackle during our presidency will be revealed according to the directions given from Chancellery of our Prime Minister in December. So this is just a hint to tell you that we will be making ourselves busy with the continuity of care in digital age. We will ask ourselves what is the position and stance of a patient towards the changing reality, the technology that appears to penetrate the healthcare sector. We would try to think about cross-border services development in the context of EU collaboration, as well as in the context as the expected EHDS regulation publication. What is also important from our point of view is the issue of I would say, rapidly changing external factors which influence the current state of play as regards cyber security. There is a lot of that going on, and this is especially important from the perspective of Poland. So we will be delving into that as well. Within the framework of our presidency, we will be organizing the standard formats like eHealth Network or eHealth Network working groups, also EMSEC groups, as well as we will try to stay on top of the EHDS, European Health Data Space implementation agenda, just to prove ourselves useful for both member states and Commission. I think I will stop here. I will happily answer questions should there be any from the audience. Thank you very much for your attention.
Hubert, thank you very much. Very insightful overview of digital health in Poland. And I suspect that for lots of the companies and healthcare providers listening, as well as perhaps the researchers, they will realize that Poland is a good place to go and practice digital health and get involved in what you are doing. But the first question is, what opportunities do you think digital health brings for Poland in the context of the next 5 years?
Thank you for this question. It's definitely it has to do with health data. I would say that from our perspective, health data becomes a significant element, ever more so. The element that is a pillar of both the functioning of domestic realm of digital health and the European cooperation. We all know that we're expecting significant changes as regards the processing of primary, secondary health data in EU member states. There is certainly an opportunity there. I sense it very strongly. But in order to take advantage from the possibilities that will open really soon, we need to do significant homework domestically. And by that, I mean, and this is not the first time that I'm referring to this, that we need to be ready to be able to process the data in order to enhance our productivity and our competence and become even more competitive. And now I am really saying this clearly because this is again something that we are working on in Poland, but it applies in a wider context also in other member states. So in order to make use of this opportunity, we need to be ready. We need to be working together, and we need to make the most of the possibilities that are created with the EHDS. And at the same time, we need to be cautious that the value added flows from the EHDS flows mainly to EU member states. So we need to be cautious of that.
Thank you. And that resonates with what Ine Vasco earlier this morning was talking about in the context of digital health globally, if you like. And a quick last question. What do you see as the biggest challenge Poland might face adopting and integrating digital health solutions? And how do you think policymakers and healthcare providers can work together to overcome them?
There are several aspects of that area. I would say that we need to be aware of the certain momentum and the certain speed with which the digital transportation is still manageable and still makes sense, because one cannot reform and introduce significant changes without the appreciation, the awareness, and the knowledge which should develop on the part of end users, be it patients or health professionals. And we need to understand that there is a certain dynamics with which we introduce technology. Technology also brings with itself certain challenges. Those could be of an organizational character, but also of legal character, and of those may pertain also to aspects related with safety and cybersecurity. We know that the artificial intelligence has been a buzzword for, I believe, many months now. And we know that the language models, ChatGPTs, or some national iterations have been tested and have proven to be very responsive in terms of bringing relevant information once asked a proper question. We know that possibly there is a perspective to use this technology, I mean artificial intelligence, in a wider context in healthcare. We need to be aware that artificial intelligence needs to be secure, needs to be safe, and it needs to be understood. There are many open questions as regards artificial intelligence in healthcare, and we've been analyzing those internally in Poland. We have created, with the help of private organizations, we have created a white book of artificial intelligence in Poland, in which we ask those questions. Is it okay to use artificial intelligence? Should patients or doctors be informed about that the tool they're using is AI-based, or the diagnosis or information that they are generating is AI generated, and so on and so forth. So with the new technology, we need to make sure that we have done everything right in terms of organizational and legal framework for this new technology to operate at an optimum level. I also refer to awareness, and the third comment of end users, and the third comment that I would like to make is that we need to make sure that the solutions we offer are secure in a way that we are not easily reachable by some malignant activity, because as in the case of Poland, which runs digital health solutions centrally, we have exactly one chance to make things right. So in order for it to work out, we need to build up trust towards the actions that we are doing in the public sector, and for that we need a good offer, a good service, and a secure way of providing this service.
Hubert, thank you so much. It's been very insightful. I really appreciate your time, and thank you again. For the rest of the audience, I'm afraid that Miklos Satcher, who's in the United States, has had technical problems, so he is unable to join us. So we're going to release you early for lunch. Please come back promptly at 2 p.m. CET. So thank you very much.
Thank you for having me.